Te acompañamos en los pequeños como en los grandes pasos de tu vida. Tenemos una manera de sentir la vida que compartimos todos. Es querer ser mejores en nuestras vidas y eso trasciende en nuestra profesión. Es una búsqueda, una forma de ser. Es creer en lo que hacemos, mejorar la salud y calidad de vida de las personas. Es una forma de trabajar con pasión, de aprovechar lo mejor de la ciencia para crear medicamentos y productos innovadores. Somos la tranquilidad que siempre va a estar de tu lado. Desde que naces hasta la plenitud de tu vida. Un camino que recorremos juntos haciéndonos más confiables a cada paso. Te acompañamos en tu nacimiento. Estamos con tu familia, tus amigos, tu trabajo y tu profesión. Y esa cercanía es lo que nos reconforta. Somos confianza en nuestros colaboradores. Somos cultura de excelencia y búsqueda de calidad. Pero sobre todo, somos bienestar. Megalabs. Somos bienestar.
Hola a todos. Estamos aquí esta vez conversando con nuestro amigo el profesor Thomas Knoll, que nos acompaña en el Congreso, un antiguo conocido de Alemania que ha venido varias veces a Chile y que le encanta participar con nosotros en distintas actividades. Thomas, hi, how are you doing?
Hi Sergio, I'm doing very well.
Very well.
How are you doing?
Fine, thanks. Tell us a little bit about yourself. Where do you work? What's your area of interest and how have you done it?
Yeah, so I'm currently working in southwest Germany, close to Stuttgart. I'm head of a department that offers the full range of urology. We are affiliated with the University of Tübingen. However, I'm still an associate professor of Mannheim University Hospital that belongs to Heidelberg University, where I did my training with Peter Alken. And,
yeah, we met there about 20 years ago already.
Yeah. Probably longer.
Probably longer, yes. And how did you come to be so well known regarding stone treatment?
I don't know, because nobody cared about stones.
Okay. So
nobody else. No, I don't know. I mean, that was probably due to my boss Peter Alken, whom you know good as well, and he was the inventor of PCNL. So stones was always a major topic in Mannheim, and when I was a young resident, I was keen on doing something with oncology and prostate cancer, and he said, "No, Thomas, you are doing stones in a scientific manner." And the first moment I was not so happy because I wanted to do prostate cancer as everybody, but at the end it turned out very well because my interest in stone disease and the underlying mechanisms, but as well the treatment, were growing over the years, and Peter opened a lot of options for me. So I was at a very early stage. I was involved in EAU guidelines on stones. We did the first AUA EAU guideline together, and then the things were rolling.
What has changed in the last years? What would you say is new in stones? We've heard you speak about lasers, for example, but the technology, what is new, what's staying, what would you recommend us to have in South America?
Yeah, it's always interesting to look back, like you said, 20 years, because then what you realize, there's a big difference. Sometimes people think like there is not that much progress if you just look back a year or two. So I think interventional treatment for stones has definitely significantly changed. So when I started urology end of the 90s, we treated most of the stones by shockwave lithotripsy. At this time we had 2 lithotripters in Mannheim, and they were running all day, and this has certainly changed. Not everywhere in the same degree, but endourology, so uroscopy, but as well PCNL, have gained much more impact, and shockwave is losing its positions if it's not already lost. So that is one major change, and that's due to miniaturization, better instruments, mainly for flexible uroscopy. But it's as well lithotripsy, and here with the laser technology.
There's been lots of new lasers coming out. What's your general opinion? Is there one that's going to stay, or going to win, or must we wait a little bit?
Well, you can always wait. So, I mean, for 15 years or so, we thought that the holmium laser is what we were looking for since the 70s. And it was used for everything, and we thought, okay, that is end of evolution. So that is the laser we will always use. And there was some evolution with the laser, with the holmium laser. So we had lasers with a higher power level that allowed us to play around with frequency settings, with pulse duration, with pulse modulation. But then it was interesting. I think that was maybe 8 years ago or so, there were first rumors of a completely new laser for stones coming up, the thulium fiber laser, and the expectations were very high over years, and the thulium fiber lasers are there, and what they offer is a very, very good dusting capability, much better than most holmium lasers, but they have some limitations, like for hard stones, and it's interesting that the development does not stop. So there's a pulsed thulium YAG laser now, in contrast to the continuous wave lasers that we know for prostate enucleation, which offers well, good effect for dusting and fragmentation. And well, it's probably not the time to wait, but to expect. And it's interesting always that you thought for a decade or more that we have what we need. Yeah. And then new developments come up and offer other advantages, and they trigger again that people start thinking and develop new lasers, and there are even newer concepts on the horizon with new technologies. So yeah, we will see. It's interesting.
Yeah. And what about the scopes?
Yeah,
a lot has changed.
Yeah.
For example, for us in South America, single-use scopes have been a big deal. Because you don't have to wait until someone buys the other one for you. So what's your opinion about that? Or do you have any experience with single-use scopes?
Yeah, my experience is there, of course, and my what I think about has changed significantly. So for years when they came up, I used them only as a backup. So if the conventional scopes are broken in maintenance, and I always had one, and there was no need to cancel a procedure. This has changed for me because the repair costs per case are so high, and we calculated this a few years ago. And at the same time, I mean, in the beginning there was just one company offering disposable scopes. Now we have 10, 15 or so. And the prices for the disposable scopes are going down. And what we realized is that the mean repair rate per patient with a conventional scope and the cost for a single-use scope are almost the same now. Okay. So what happened is that we are changing completely to disposable scopes.
Yeah, that's interesting. Nice to know, because we have some concerns because disposing so much material and the eco and the environmental thing, it's an issue.
Yeah, there are companies working on this. I think the carbon dioxide footprint, but as well the plastic at the end needs well, some kind of thinking to deal with it. And I know that there are companies who really work on this, who take back what you use and do well some kind of recycling. But that is certainly an issue, not only for disposable scopes, I mean for everything in life. Yeah.
Yeah. So, and another question for me is your opinion about this Congress. How have you been here?
So it's my first cow meeting. It's not my first visit to Chile, and it's quite interesting. It's a big meeting. I mean, much bigger than the Chilean. So we have all the South Americans. And it's a very diverse program. We had a very nice workshop this morning on uroscopy, which was crowded at 7 o'clock. 7 o'clock in a German meeting is empty. So people are really enthusiastic and keen on learning. And yeah, it's my first day today, and I'm looking forward.
Thank you very much. Muchas gracias, Dr. Knoll. Como siempre es un agrado juntarnos aquí con amigos y poder compartir con ustedes también todos sus conocimientos. Para cerrar un poco, hay que adecuar el tratamiento a los pacientes, hay tecnologías que están cambiando, muchas variedades de láser, todavía no está definido exactamente cuál es el mejor y está avanzando la tecnología todos los días, hay que estar atentos. Podemos participar en eso como CAU, como urólogos de Latinoamérica activamente, así que es un orgullo poder estar aquí aprendiendo y mostrando lo que nosotros podemos hacer. Muchas gracias.